Hello students, I welcome you all to Obstetrics and Gynecology with Mackler. So in this module, we're going to deal about the most important topic of gynecology, and that is all about the abnormal or atypical uterine bleeding. So abnormal or atypical uterine bleeding is definitely a symptom of any uterine pathology, right? If we take into consideration any kind of fibroids, uterine polyps, cervical polyps, and adenomyosis, so any pathologies of gynecology wherever you are going to discuss, definitely that is going to have some symptoms such as atypical uterine bleeding. So before discussing about the atypical characteristics of the menstrual cycle, it's very important for us to know about the normal characteristics of the menstrual cycle. So first let's discuss about the normal characteristics of the menstrual cycle. So the normal characteristics of menstrual cycle can be discussed in terms of 4 criteria, and those are the frequency of the cycle. How frequent is the cycle in a female? So every month, how frequently she's having her cycles. The second is cycle to cycle variation. How much is the cycle to cycle variation she is having? And the third one is the duration of flow. How much is the duration where the female is experiencing menstruation, and how much is the volume of blood loss which is happening in a female. So these are the 4 important criteria which are taken into consideration while describing about the normal characteristics of menstrual cycle. So how much is the frequency of cycle? So the normal characteristics of the frequency of cycle is somewhere around 24 to 38 days. Right? So between 24 to 38 days is the normal frequency of the cycle. So how frequently she can have her periods? She can have around 24 to 38 days frequently she can have her periods. That is the normal characteristic of menstrual cycle in terms of frequency of cycle. And what is the cycle to cycle variation? She can have her cycle to cycle variation by around 2 to 20 days. So the cycle to cycle variation between one menstrual cycle and the other menstrual cycle, the variation could be around 2 to 20 days, which are the normal characteristic of menstrual cycle in terms of cycle to cycle variation. But recently, the Federation of International Obstetrician and Gynecologists, they have proposed this new proposal by FIGO is that originally it was around 2 to 20 days, which was considered to be the normal cycle to cycle variation. But now they are saying that around 7 to 9 days is normal. Right? So earlier it was told 2 to 20 days, but now the new proposal, which was released by the Federation of International Obstetrician and Gynecologists by 2018, they tell us between 7 to 9 days it is the normal cycle to cycle variation. And what about the duration of flow? So any flow which is happening for around 4.5 to 8 days is considered to be normal. So earlier it was said about 4.5 to 8 days is considered normal, but the new proposal tells that any bleeding up to 8 days is considered normal, and anything which is more than 8 days, that is actually abnormal. Right? Okay. So now discussing about the volume of flow. So we are going to discuss the volume in terms of ml. Right? The blood is going to be estimated in terms of ml, and anywhere around 20 to 80 ml is considered as normal. So between 20 to 80 ml, if a female is having her blood loss in a menstrual cycle, somewhere around 20 to 80 ml is considered normal. Anything below and anything above is considered to be abnormal. So whatever we have stated here, if it is going to be less than these set days, or if it is going to be more than these set days, it is considered as abnormal, right? So the frequency of the cycle has to be 24 to 38 days. Cycle to cycle variation, it has to be 2 to 20 days. Earlier, a new proposal tells that it has to be 7 to 9 days. And the duration of flow can be 4.5 to 8 days, which was earlier said. The new proposal by FIGO says that up to 8 days is normal. Anything more than 8 days is considered abnormal. Clear? Okay. What about the volume? So volume between 20 to 80 ml is considered to be normal. Right? So we have discussed the normal menstrual cycle characteristics in terms of frequency, cycle to cycle variation, duration of the flow, and volume of the blood flow. So now we'll discuss about the abnormal menstrual cycle. So whatever characteristics which we have discussed in the earlier section, those are considered to be normal. So anything which is going to differ from this normal days or normal set proposals, that is considered to be abnormal. In terms of, let me discuss you here very clearly. So what is atypical or abnormal uterine bleeding? So anything which is going to differ from the normal characteristics of menstrual cycle is considered abnormal. It could be anything which is less than, or it could be anything more than the set days, right? So let's discuss that now. So we considered about the frequency of the cycle. So I told that between 24 to 38 days, it is considered as normal features of menstrual cycle. But if the cycle is going to be more frequent, that between one menstrual cycle and the other menstrual cycle, it is only less than 24 days, it tells that the cycle is more frequent, because in less than 24 days itself, she is going to have a next cycle. So you can term it as frequent cycles. So the new term is, when the frequency of the menstrual cycle is less than 24 days, it is called as frequent cycle. But the old term which was given was polymenorrhea. Polymenorrhea. So frequent cycles are also called as polymenorrhea, where the frequency of the cycle is less than 24 days. Then, if the frequency of the cycle is more than equal to 38 days, it is an infrequent cycle, because she is having a cycle, she is having a next cycle only after 38 days, which is even more than a month period, right? More than a month is taken for her to have a next menstrual cycle. So it tells me that it is infrequent cycle. So frequency of the cycle more than 38 days is called as infrequent cycle, which is also called as oligomenorrhea. It is also called as oligomenorrhea. So the new term is infrequent cycle and the old term was oligomenorrhea. So frequent cycle is also called as polymenorrhea. Infrequent cycle is also known as oligomenorrhea, right? Yes. So anything which is less than the set days or anything which is more than the set days is considered to be abnormal. If it is going to be less, it is frequent. If it is going to be more, it is infrequent in terms of frequency of the cycle. So now we take into consideration the cycle to cycle variation. So I told you earlier, they said that 2 to 20 days is considered to be normal, but the new proposal tells that 7 to 9 days is considered as normal. But right now we'll take into consideration the 2 to 20 days. Okay, so any bleeding which happens in a cycle to cycle variation of 2 to 20 days is considered to be regular. So those are regular cycles. In a gap of 2 to 20 days, if it is going to happen in the next subsequent month, it is considered to be a regular cycle, right? But if it happens more than 28 days, if the cycle to cycle variation is going to be more than 20 days, it is an irregular cycle, right? If the cycle to cycle variation is somewhere around 2 to 20 days, it is considered to be a regular cycle. But if the cycle to cycle variation, that is between one menstrual cycle and the other menstrual cycle, if the variation is going to be more than 20 days, it is an irregular cycle. So let's say, for example, she's having her periods right? So now what is the cycle to cycle variation here? So between November and December, she had by 20th on November, and by 28th of December, she had her next cycle. This was first cycle, this was second cycle. So the cycle to cycle variation is around 8 days. Between 20 and 28, there is 8 days. So this 8 days falls between 2 to 20 days. So that is considered to be regular. But if the cycle to cycle variation is going to be more than 20 days, then it is considered to be an irregular cycle. Is that clear? Yes. So if the cycle to cycle variation is between 2 to 20 days, it is regular. If it is more than 20 days, it is considered to be irregular. Right? Okay. Let's say, for example, if she is not having any bleeding, no menstrual cycle. No menstrual cycle is called as amenorrhea. What is amenorrhea? So menorrhea means menstruation. Menorrhea means menstruation. Anything A before a term is called as absence. So absence of menstruation is called as amenorrhea. Clear? So amenorrhea is known as absence of menstruation. Clear? Yes. So now we are going to the duration of flow. So I told you any flow which is happening between a duration of about 4.5 to 8 days is considered to be normal. And later the new proposal said that any bleeding up to 8 days is considered normal, and any bleeding which happens at more than 8 days is considered to be abnormal. So now, what is the abnormal features? So any bleeding which occurs at less than 4.5 days is a shortened bleeding. So less than 4.5 days any bleeding is occurring, it is a shortened bleeding. If the bleeding occurs for more than 8 days, it is considered to be a prolonged bleeding. So for more than 8 days, she is still having a periods, she is still menstruating, she is still losing blood. So more than 8 days she is menstruating still, so it is a prolonged bleeding. Less than 4.5, it is a shortened bleeding. Can you understand this? Less than 4.5 is shortened bleeding, more than 8 days is prolonged bleeding. Clear? Yes. So there are some confusions and controversies whether it is less than 4.5 days or it is less than 2 days. So both are actually discussed by many people, right? So you just take into consideration whether it is less than 4.5 days or less than 2 days, it is a shortened bleeding. More than 8 days, it is a prolonged bleeding. Clear? Yes. So now let's discuss about the volume of the blood flow. So if a female is going to lose blood around 20 to 80 ml in her one menstrual cycle, it is considered to be a normal characteristic of menstrual cycle. But if the blood loss is going to be somewhere less than 20 ml, it is called as light bleeding, because only 20 ml, less than 20 ml of blood has been lost from her body. So that is a light bleeding. But if in case the bleeding is going to be more than 80 ml, more than 80 ml of blood has been collected in a single menstrual cycle, then it is a heavy bleeding. It is a heavy bleeding. It is not a light bleeding, it is a heavy bleeding. Right? Okay. So what is the other name of this light bleeding and heavy bleeding? So light bleeding is also called as hypomenorrhea. Hypomenorrhea. Heavy bleeding is also called as menorrhagia. You always need to remember this one term, which is very important, right? Please remember. If you ask me what is that one term which I want to remember out of all of this, is this one term, that is menorrhagia. Menorrhagia means heavy menstrual bleeding. So heavy menstrual bleeding in terms of duration of flow and volume of flow. That is, if the duration of flow is going to be more than 8 days and the volume of flow is going to be more than 80 ml, it is a case of menorrhagia. So therefore, prolonged bleeding is also known as menorrhagia. Shortened bleeding is also called as hypomenorrhea. So it is very simple. So the duration of flow and the volume of blood flow is going to have the same definition, that is hypomenorrhea and menorrhagia. Hypomenorrhea is when the duration of flow is less than 4.5 or less than 2 days, and when the volume of blood loss is less than 20 ml, it is called as hypomenorrhea. Whereas menorrhagia means when the duration of blood flow is more than 8 days and the volume of blood loss is more than 80 ml, it is called as menorrhagia. So for duration and the volume, we take into consideration the hypomenorrhea and menorrhagia in terms of duration of flow and volume of flow. Right? Is it clear for all of you? So polymenorrhea is when the cycles are very frequent, less than 24 days. Oligomenorrhea, cycles are infrequent, more than 38 days. Regular cycles, cycle to cycle variation is between 2 to 20 days. Irregular cycle to cycle variation is more than 20 days. Amenorrhea, absence of menstruation. Hypomenorrhea, shortened bleeding, light bleeding. Menorrhagia, prolonged bleeding, heavy bleeding. Clear? So this is all about the atypical or abnormal uterine bleeding. Is that clear? Yes. So now let's get inside what are the actual causes of abnormal uterine bleeding. So definitely this has to have some cause. So we have grouped this cause into two. That is structural causes and the non-structural causes. Structural causes are those which are going to distort the shape of the uterus. Non-structural causes are those which are not going to distort the shape of the uterus. Clear? Structural means anything which is going to distort the uterus, that is structural, and anything which is not going to destroy the uterus is non-structural. So this goes by the famous term called palm-coin classification. Palm-coin classification. Yes. So PALM. PALM is structural causes. COIN, COEIN, all the non-structural causes. So P stands for polyps. P stands for polyps. A stands for, yes, adenomyosis. Adenomyosis. L stands for leiomyoma. Leiomyoma is also called as fibroid. M stands for malignancy. Any kind of malignancy, gynecological malignancy, it can have abnormal uterine bleeding. Malignancy or hyperplasia. So these are the structural causes. So now let's discuss about the structural causes. So when taking into consideration the polyp, which are actually the smooth muscle tumor, right? Smooth muscle tumor is fibroid. So when discussing about the polyps, which are nothing but, it could be either an endometrial polyp which arises in the uterine cavity or an cervical polyps. So polyps are nothing but they could be either sessile or pedunculated polyps, right? So it could be either an endometrial polyps or an endocervical polyps. The second one is adenomyosis. What is adenomyosis? Adenomyosis is a condition where the endometrial tissue is going to encroach or present in the myometrium, right? When the endometrial tissue is going to be grown inside the myometrium, it is called as adenomyosis. And what is leiomyoma or fibroid? It is a smooth muscle tumor of the uterus. It is a benign tumor. And M stands for malignancy, any gynecological malignancy or hyperplasia. Hyperplasia is increase in proliferation of the uterine endometrium. Clear? Hyperplasia is increase in proliferation of the uterine endometrium is called as hyperplasia. So this is all about the PALM. So now we are going into the COIN classification. So COIN stands for the non-structural causes. So what are the non-structural causes that we know? So C stands for C stands for coagulopathy. Any known coagulopathic disorder that could be a cause. So C stands for coagulopathy, and O stands for ovulatory dysfunction. So O stands for ovulatory dysfunction. Clear? Yes. And E stands for any endometrial causes. And I is iatrogenic, and N is not otherwise classified. Not otherwise classified is N. Clear? Yes. So we have the two causes, that is the structural and the non-structural causes. And the structural causes are PALM, P-A-L and M. P stands for the polyps, and A stands for adenomyosis, L stands for leiomyoma or the fibroid, and M stands for malignancy or the hyperplasia. So polyps are nothing but they are the localized overgrowth of the endometrial glands and stroma, right? So it is the overgrowth of the endometrial glands and stroma is called as the polyp. Whereas adenomyosis is when the endometrium is going to grow inside the myometrium, where the junctional zone is going to be get thick and where it is more than 2.5. Right? And L stands for leiomyoma or fibroid, which is the smooth muscle tumor of the uterus. And M stands for malignancy or hyperplasia. And C stands for coagulopathy. So any coagulopathic disorder, any family history of coagulopathy, if that is present, and that is a cause of this abnormal uterine bleeding. The most important is von Willebrand disease. So this is more important. And O stands for ovulatory dysfunction, such as the anovulation. E stands for any endometrial causes, and I stands for iatrogenic. Iatrogenic is when the doctor by themselves are going to cause this bleeding, and iatrogenic could be because of any oral contraceptive pill consumption, any intrauterine contraceptive device insertion. So we are doing the procedures, right? So iatrogenic causes could be either oral contraceptive pills or intrauterine contraceptive device, and N stands for not otherwise classified. We are not able to classify that, and that the causes could be any kind of inflammation of the endometrium, that is endometritis, or it could be any AV malformation as such. Clear? So these are the causes of abnormal uterine bleeding. So structural or the polyp adenomyosis, fibroid malignancy or hypoplasia, non-structural or coagulopathy, history of family inherited disease such as von Willebrand disease, ovulator dysfunction and ovulation, endometrial causes, iatrogenic such as IUCD, oral contraceptive pills, and is not otherwise classified. So these are the most important causes of abnormal uterine bleeding. So in terms of what these bleeding are going to be present, so polyp is going to have an intermenstrual bleeding, intermenstrual or irregular bleeding. Adenomyosis is going to have heavy menstrual bleeding and dysmenorrhea, pain during menstruation will be present. Fibroid will also have heavy menstrual bleeding. Clear? Yes. And malignancy will definitely have bleeding, and that could be either a heavy menstrual bleeding or it could be a postcoital bleeding. After the act of coitus, the patient might have postcoital bleeding. So postcoital bleeding is very significant, which most commonly signifies cancer cervix. So it could be either spotting per vaginum, it could be bleeding per vaginum, or it could be postcoital bleeding as such. And coagulopathy, so one probable history is that if the patient is having any history of bleeding gums, any history of bleeding during dental workup, history of epistaxis, that is bleeding from the nose at least once in a month, and any major blood loss with any surgery. So all these will approach us towards the diagnosis of any coagulopathy, and we also need to rule out whether there was any family history of coagulopathy being present in this patient. If you are going to suspect coagulopathy, the most probable period is that when a female is going to start her menstrual cycle, that is once she attained the puberty and she is going to have a menarche, right from her menarche she is going to have this heavy menstrual bleeding. So whenever a female, an adolescent female, when she is going to attain the puberty and starts getting her menstrual cycle for the first time, which is called as menarche, if the cycle is going to be heavy menstrual bleeding is going to be present in her, the causes could be two things. One is that initially for around 1 to 2 years the cycles are anovulatory cycles. So because of anovulation, the female might have this heavy menstrual bleeding. But the other cause which has to be considered is this coagulopathy. So if that female is a known case of coagulopathy, so definitely right from the puberty she is going to have heavy menstrual bleeding. So puberty menorrhagia, that is called as puberty menorrhagia. So whenever a female who attains the puberty, she is going to have menorrhagia, you need to evaluate her, and the causes could be either anovulation, anovulatory cycles, or coagulopathy. And any sort of ovulator dysfunction, anovulation, and endometrial causes, and iatrogenic such as oral contraceptive pills, intrauterine contraceptive devices, and not otherwise classified, such as any sort of AV malformations which will require you to do a Doppler only when you can know whether any AV malformation is present, and endometritis, chronic inflammation of the endometrium. Right, so these are the causes of atypical or abnormal uterine bleeding. Now, what are the types of abnormal uterine bleeding? So it could be either acute or chronic in nature. Acute is when the female is going to have very prolonged and heavy bleeding which is severe enough to require medical intervention. Severe enough to require medical intervention. So whenever a female is going to have severe menstrual bleeding and which is severe enough to require medical intervention, that is called as acute abnormal uterine bleeding. So what is a chronic abnormal uterine bleeding? So chronic is when the patient is going to have this abnormal or atypical uterine bleeding for a period of more than 6 months. So right from the past 6 months, she is having this atypical or abnormal uterine bleeding characteristics in terms of frequency of the cycle to cycle variation, duration of the flow, and volume of the blood flow. And anything which is happening for more than 6 months, it is considered to be a chronic atypical uterine bleeding. So I hope this is more than enough for this module, that we have discussed about the normal and the abnormal characteristics of the menstrual cycle, and also we learned about the new definitions and the causes of this abnormal uterine bleeding and the types of abnormal uterine bleeding. In the subsequent module, we'll be discussing things even more detailed so that you will have a very clear idea about this abnormal uterine bleeding. We also doing the investigations which has to be done in a patient with abnormal uterine bleeding, followed by what are the treatment options depending upon the pathology present in that patient. So all these things will be discussed in the subsequent modules. So until then, please keep studying, students, and please subscribe to this Mackler YouTube platform so that you will be getting the daily video updates.